Okay, the next student I would like to discuss is Evie. Evie is a 14-year-old female student in the 8th grade. She lives at home with her father and sisters, three other sisters. Um, it is noted that Evie's mother passed away in 2012 from a car accident, and since then, Evie and her sisters have been going through extensive counseling. Um, Evie has a significant medical history for spinal bifida, among other things. Evie was delivered at 30 weeks gestation, and she spent the first 2 months of her life in a neonatal intensive care unit. Um, Evie was delayed on all of her developmental milestones, according to her father, and she has been receiving special education services since she was first evaluated in preschool in 2008. She was then identified as a student with developmental delays in 2008, and she had a comprehensive evaluation in 2011, and her eligibility was then changed to other health impairment. In October 2014 and in October 2017, Evie's eligibility for special education was continued on both of her 3-year evaluations. In September 2019, Evie's father requested that she undergo a full comprehensive evaluation to gain a better understanding of Evie's strengths and weaknesses. Evie participates in the general education classroom except for when she has special education, um, except for when she goes to the special education classroom where she receives services. Evie has received special education services for academics, reading and math, language therapy, and physical therapy. In 2017, Evie's IEP team determined through benchmark testing and teacher gathered data that she no longer needed to receive special education resource reading or language therapy. Evie was placed on consultation services for 1 year and was completely exited from reading and language services in 2018. She is currently receiving special education services for resource math 5 days a week, 30 minutes per day, and physical therapy 1 day a week for 30 minutes. Okay. To determine her intellectual skills, Evie was given the Kaufman Brief Intelligence Test 2, KBIT 2. This is a brief, individually administered measure of the verbal and nonverbal intelligence of a wide range of children, adolescents, and adults spanning ages 4 to 90 years old. The two-domain composition of the KBIT2 produces an IQ standard score that covers two distinct aspects of intellectual ability, allowing children and adults to demonstrate their capabilities across two very different skill areas. Evie obtained an IQ composite of 94 on the KBIT2, which is well within the average range and the 34th percentile. Evie scored below average on the verbal IQ with a standard score of 88 and average on the nonverbal IQ with a standard score of 101. To measure Evie's achievement, she was given the Woodcock-Johnson 4. This was developed to determine and to describe the present status of an individual's level of achievement. It's been used to assist in the diagnosis or the identification of specific weaknesses that may be interfering with related aspects of academic development. Evie's broad reading skills fell in the average range. Her broad math skills fell in the below average range. Evie scored above average on all of the reading composites and subtests. Evie displayed an area of weakness in her math calculations with a standard score of 74. to test Evie's adaptive skills. She was given the Adaptive Behavior Assessment System, 3rd edition, ABAS3, and this is a comprehensive, norm-referenced assessment of adaptive behavior skills for individuals aged birth through 89 years. Adaptive behavior skills are measured by the ABAS3. They are defined as those practical, everyday skills required to function and to meet environmental demands. Evie's father completed this ABAS3. Evie's behavior was rated within the average range on the conceptual and social composites of the ABAS3. She was rated low on the practical composite with a standard score of 79. The general adaptive composite, GAC, is considered to be the overall indicator of adaptive skills. Evie obtained a score of 87 on the GAC. Relative to individuals of comparable age, Evie is currently functioning at the 19th percentile, and her overall level of adaptive behavior is described as being in the low average range. To assess Evie's communication and language, the speech pathologist administered the Oral and Written Language Scales, 2nd edition, OWLS 2, with a broad average score ranging from 85 to 115. Evie's score on the OWLS 2 fell within the average range. The Oral Language Composite score of 91 is average. Mrs. Mitchell, the speech and language pathologist, reported that Evie's listening comprehension and oral expression skills are within the functional limits for academic performance. Evie's language skills are not significantly delayed for her age. Okay, so the conclusion of these results are as follows. Current testing suggests Evie is functioning in the average range of intellectual ability as measured by the KBIT-2 with an IQ composite of 94. On the Woodcock-Johnson 4, all areas of reading were noted to be within the average and the above average range. Evie's math calculations, however, fell in the below average range. On the ABAS3, Evie's general adaptive composite standard score of 87 also falls in the below average range. Evie's self-care skills were rated as an area of significant personal weakness for her. The most recent language evaluation from the OWLS 2 revealed an oral language composite of 91 with no deficits noted with listening comprehension or expression. Evie has a documented history of medical diagnosis that could impact her functioning and her performance at school. Evie continues to meet eligibility standards as a student with other health impairment based on her most recent evaluations. It is recommended that Evie continue to receive special education services for a deficit in math calculation and physical therapy services based on her doctor's most recent statements. The following are recommendations that the IEP team may consider when writing Evie's IEP. Evie should be monitored in reading because there was a history of a reading deficit. She should be given daily math practice on math calculation skills such as fact fluency drills and flashcards. And Evie should be allowed extended time on her math assignments and tests. Teachers should provide opportunities for reteaching, and extra credit should be given when Evie is struggling with math skills concepts. And finally, Evie should be allowed to take home and complete any math assignments that she was not able to complete in class. And these are recommendations for Evie. Thank you.